Hello everyone, my name is Mackenzie Bone and I'm a first-year medical student at the University of Saskatchewan. I would like to start off by acknowledging that we at the University of Saskatchewan are on Treaty 6 territory and the homeland of the Métis. Today, I'm happy to be speaking with you on behalf of our research team regarding our scoping review we conducted on social isolation and loneliness amongst persons with spinal cord injury. Social isolation and loneliness have gained increasing attention as major health concerns that have been associated with increased mortality, poor cardiovascular health, and negative mental health outcomes. Much of the literature regarding the effects of social isolation and loneliness currently focuses on the older adult population. Given that persons with spinal cord injury have reported decreased quality of life and poor mental health, isolation and loneliness may be a concern in this population as well. Therefore, we were interested in conducting a scoping review to determine the current understanding of social isolation and loneliness amongst adults with spinal cord injury living in a community setting. In light of the COVID-19 pandemic, we believe this issue is becoming increasingly important. We followed Arxion O'Malley's framework for scoping reviews and searched 4 databases. Multiple reviewers were independently involved in the screening and appraisal process. I wanted to highlight that articles had to be focused on persons with spinal cord injury in a community residence setting, and that studies looking at isolation or loneliness in a hospital or rehabilitation setting were not included. Additionally, the articles had to focus on loneliness or social isolation as primary outcomes, and articles that mentioned these topics solely in the introduction or discussion as a minor theme were not included. As indicated by our PRISMA flowchart, after removal of duplicates, 2,112 articles were screened. 119 studies were excluded during the full-text review, mostly due to the wrong patient population or wrong outcome measures. 15 papers met all of the inclusion and exclusion criteria and were included in our review. Of those, the majority were published more recently since 2015, which highlights the increasing attention social isolation and loneliness have gained as major health risk factors. Below, you can see that about half the articles were from North America and quantitative in nature. Most studies found that individuals with spinal cord injury experience social isolation or loneliness at some point, but not necessarily everyone and not consistently. Some studies reported higher levels of social isolation or loneliness when compared to the general population or their romantic partners. Many studies focused on the period after returning home from rehabilitation and found that experiences of isolation and loneliness were common in this period, suggesting that this may be a particularly vulnerable time. Several expected associations between isolation and loneliness and other psychological variables were found, such as poor satisfaction with life, self-esteem, and mental health. These experiences varied with many factors, including injury severity, relationship status, employment, and participation in leisure activities. Very few studies looked at how social isolation and loneliness changed over time, and it is unclear whether these experiences tended to decrease or increase over time. In conclusion, after reviewing all 15 papers, it became clear that much like other aspects of spinal cord injury, individuals had very heterogeneous experiences with social isolation and loneliness as well. Next steps in this area of research should aim to further understand experiences of isolation and loneliness and to identify the best means of improving the quantity and quality of relationships for persons with spinal cord injury, especially in the period after rehabilitation. Thank you for listening today.